So the different signs and symptoms that I'm going to talk about here specifically. So, if you have a look at, let's start with how our body responds. So, the physiological changes that take place. So, we might experience fatigue or tiredness. There's a lack of energy. We might experience memory loss or changes in our concentration. There's a decreased pain tolerance. We might experience changes in our sleeping behaviors as well as our eating behaviors. And then you can see that there's a little thought bubble, a little hand for behavior, and a little heart for feelings, because that is what mental health is. It affects the way we think, feel, and act. And when a disorder like depression is taken into consideration, it resembles that something is happening that is not within context. We're looking at the intensity, we are looking at the frequency in which these symptoms are taking place. So if you identify with a few of the following symptoms, please make a note. It's very important that you seek professional help if you identify with all these areas. So, for example, if you identify with physiological symptoms, behavior, feelings, and thinking, if you identify with at least two from every aspect, please seek professional help, right? And then how we think. So, for example, I'm a failure, no one likes me, things will never get better, I'm worthless, I can't be bothered, others would be better off without me, as well as suicidal ideation. Suicidal ideation can also look like I'm not important, I don't belong here, the world would be better without me. So, it's important to take that into consideration as well. And how we feel when we experience depression, sadness obviously is there, unhappiness, we experience being overwhelmed, we have low patience, we are irritable, tearful, hopeless. We experience feelings related to being worthless. There's a sense of helplessness as well. So that takes place there as well. The the manners in which we may behave. So we may experience difficulties in concentrating. We may withdraw from activities that we once enjoyed and that brought us pleasure. We withdraw from close family members and friends, and we are not getting work done, or we are very demotivated. Also, we are relying on alcohol or drugs as a sense of coping. So these are very good indications that we need to get further assistance. Please know that there's nothing wrong with asking for help. Before you are anything, before you are a mom or a dad or a brother or a sister or whatever role you play at work, you are a human being and you can't run away from your human condition. And I understand that sometimes we relate this asking for help to a sense of weakness, but really support and comfort does change things for us. It does influence the situation. It does help get us achieve a better sense of wellness. And at the end of the day, if that is available, let's welcome this for ourselves. So I'm really going to encourage that throughout the session and normalize that. Um, and really, really, I'm hoping that if you identify with anything that is being discussed in the session, that you seek that professional help that's needed. Myths about depression. So simply snapping out of it. Those that have depression are usually told to snap out of it. What's so important to acknowledge is that no one chooses to be depressed. I think that, judging from the set of symptoms experienced and the difficulty of these experiences, no one chooses this upon themselves. And also, someone who is depressed can't just shut it off or suck it up, buttercup, like we usually say. If it was that simple, obviously no one would be depressed. No one would want to experience depression if it was a choice. Depression depression is a psychological, social, and biological condition. And again, if you suspect that you are experiencing depression, please contact your nearest GP or make an appointment with a mental health care practitioner. The belief that talking about my feelings and my thoughts makes it worse. This is a common misconception that talking about our feelings and our thoughts will make our depression worse, as it will only reinforce the overwhelming feelings and keep us fixated on negative life experiences. However, in reality, being alone with our thoughts can be so much more harmful, because there's no one filtering out, there's no one soundboarding that for us, there's no one challenging those thoughts for us. And talking to a supportive, empathetic, and not judgmental listener has shown to really, really assist and support and help a lot of people. Um, there's really power in being heard, in being validated, in being comforted. Um, and then others are better at dealing with their lives. I am just weak. It's important to remember that on the surface, it may appear like everyone is coping better than us. And this can be due to the fact that people tend to hide when they can't cope. It may also be because when we are feeling low, we have a tendency to compare ourselves with people who appear to be doing better and not actually notice those that aren't. If I think about the red car and I go onto the road and I see all these color cars, I'm only going to identify or take note of the red cars. So what's important to understand is, in reality, depression is not a sign of weakness, not laziness either. It has social, psychological, and biological origins and can be treated in a variety of ways. And believing that you cannot cope is a common symptom of depression. And I just want to remind you, it does not mean that you are weak. It does not mean that you are lazy. There's so many different influences of depression, and you need a tailor-made treatment plan to assist you. And then depression is always triggered by something happening. So if we look here, so depression doesn't have one single cause. What's very important to take note of is that depression has multiple influences and causes, and there's not a single cause that creates depression. Depression can also take place suddenly, unexpectedly, even when things are going really well. For example, we can have all our needs met and still struggle with mental health. So that's why it's very important to seek out professional help. Please don't wait for things to get better, especially if they are proving that they are not getting better. Depression is biological. There's nothing that we can do about it, is another myth. Biology does play a role in the development of depression, but usually alongside a combination of other psychological and environmental factors. Even if depression is biological, depression is treatable, and there are many things that can be done about it. By making changes in the way that we think and that we behave, we may be able to disrupt the vicious cycles of depression that is present. And we're going to talk about the different types of therapies that regard depression. And then there are different types of depression. So you may have heard a number of different terms being used to describe depression. So major depression is broken down into various subtypes, each with a slightly different set of symptoms. So we're going to go over the few listed here. Okay, so dysthymia, which is basically persistent depressive disorder, is mild or chronic depression. It is less severe than major depression and has fewer symptoms. And usually people with this type of depression experience a chronically low mood with some moderate symptoms of depression, such as the inability to sleep or sleeping too much, low energy or fatigue, poor appetite or overeating, poor concentration, low self-esteem, difficulty making decisions, and feelings of hopelessness. And also with this disorder, the symptoms of depression can linger for a long period of time. And this is where it makes it different from major depressive disorder. It can linger for about 2 years or longer. While it is not as severe as major depression, persistent depressive disorder can still interfere with a person's day-to-day functioning as well as their relationships. So usually, sometimes when people have persistent depression disorder, they may also experience periods of major depression, and then this is classified as double depression, the term that is used, right? Then we have bipolar. I'm sure a lot of you have heard about this order. So this is the depression it was formerly known, sorry, as manic depressive illness. Bipolar disorder, like major depression, is a mood disorder. However, it is also characterized by episodes of mania as well as episodes of depression. And episodes of mania can consist of inflated or grandiose perception of oneself, excessive involvement in activities that can lead to painful consequences, impulsive behaviors. There's less need for sleep, and a pattern of racing thoughts and rapid speech and behavior. While bipolar disorder and depression share symptoms, they are separate disorders with different treatments. All right. Then we have seasonal affective disorder, which is a type of depression where mood is affected by the weather as well as the time of the year. SAD, which is seasonal affective disorder, is sometimes referred to as winter depression, as symptoms usually occur and are more severe during the winter, with the person feeling better during the spring and the summer seasons. People struggling with SAD may experience several symptoms, including low mood, which may last for months, increased sleep, and increased appetite that is characterized by carbohydrate cravings as well as weight gain. SAD is more common in the northern climates as there is a significant decrease in the hours of sunlight during winter. It is also common for people to experience mood changes during periods of decreased sunlight. However, people with SAD experience symptoms that are more severe and that interfere with their everyday functioning. And then we have postnatal depression disorder, which males can experience as well. So postnatal depression refers to episodes of depression that are followed by childbirth, and its onset may be related to hormonal changes as well as a life transition, emotional difficulties, and social circumstances. And this is where males can identify with. It is a very common condition that affects a lot of women. 1 in 10 women are affected by this. And again, men are affected by this. And usually takes place within the first year of having a child. It is characterized by symptoms of depression that persist for 4 weeks or more and interfere with the social and emotional functioning. People who have experienced depressive episodes before pregnancy or before this life transition may be more vulnerable to developing postnatal depression, natal depression, sorry. Then we have depression with psychosis. Sometimes depression can become so severe that a person loses touch with reality and experiences psychosis. Psychosis is characterized by a break with reality in which a person either experiences delusions, which is beliefs that have no basis in reality, or hallucinations, which include hearing or seeing things that are not really there. Delusions and hallucinations may be paranoid in nature or very critical and negative, which then, which then make the depressive state worse. The type of treatments involved here include both talking therapies, antidepressants, and antipsychotic medication. So then it brings us to what causes depression? I'm going to focus on 4 main points because there is no simple answer to what causes depression, what influences depression. It is important to understand that also depression is not caused by one single thing. It is a combination of several different factors that play a part in the onset of the condition. These can be grouped into 4 main categories, and they are life events, thinking style, lifestyle factors, and biological reasons. Everyone has a certain level of vulnerability or risk factors. The more risk factors a person has, the greater the stress levels the person is experiencing, and then the greater the chance of experiencing a depressive episode. Okay. So, life events. It has been evidenced that early childhood trauma and losses such as death or the separation or divorce of parents, as well as stressful adult life events such as divorce, loss of a job, death of a loved one, family conflict, retirement, can lead to the onset of depression. It is normal to feel low during these times, and often the low mood passes naturally with time, but sometimes the difficult feelings stick around for longer and actually become problematic. Experiencing several prolonged and severe difficult life events increases the likelihood for a person to develop depressive disorder. Thinking styles. So, cognitive behavioral therapy suggests that the way we think and how we interpret events and situations impacts how we feel and can lead to depression. Some of the most common thinking patterns associated with depression are overstressing the negative, taking on the responsibility of bad things happening in your life, but not the good ones, having inflexible rules about how you should behave, thinking that you know what others are thinking about you and that they are thinking badly of you. And when we are depressed, we commonly think about things in a negative manner, and this has a negative impact on our mood as well. We're going to go over a few different negative thoughts or how we manage these thoughts in later on. Lifestyle factors. Studies show that certain lifestyle factors, such as not engaging in enough physical activity, being over or underweight, and having fewer social relationships, can increase the likelihood of experiencing depressive symptoms. Sometimes a prolonged exposure to stress can lead to a development of depression. These stresses can be ordinary things such as ongoing problems at work, difficulties in relationships, and loneliness. And then we have biological reasonings. So, a family history of depression. So, this genetic predisposition. This does not mean that all the relatives will develop major depression. However, people with a family history of depression are more vulnerable to developing depression at some stage in their lives. However, an increased vulnerability to the illness does not necessarily lead to to depression itself. Remember that depression has multiple causes, all interacting together to create the condition. Therefore, a genetic predisposition alone is very unlikely to cause depression. Okay, just want to move my slide. All right. What keeps depression going? So when someone is depressed, they may experience many changes, and often these changes develop in a vicious cycle. And I'm going to give an example of the vicious cycle by using Samantha. And these vicious cycles keep depression going, and it really makes it difficult to break out of this cycle. These vicious cycles of depression consist of a combination of thoughts, feelings, behaviors, and bodily sensations. The first step is creating awareness and understanding these changes and seeing how they fit together into the cycle of depression. This diagram shows how the different areas work together, so the thinking, the feeling, the acting, and the bodily sensations, and affect each other to keep depression going. So we're going to have a look at Samantha's thoughts and see how this influences her behavior, her physical sensations, and her feelings. So if you look, the situation is Samantha makes a mistake at work that costs her company a client. So the thoughts that Samantha is experiencing is, I'm a failure, I'm not good at anything, nothing will ever get better. The feelings, of course, are sad, upset, hopelessness, and the physiological side of it is tiredness, lack of energy, sleep problems, changes in her eating behaviors. And then the behavior, which we see here, is she stays in bed and she struggles to concentrate, and then she starts withdrawing from friends. So as we can see, excuse me, a specific event triggered the cycle of these negative thoughts. And people who are depressed have a tendency to interpret events in a negative fashion. The negative interpretation of events has been argued to be one of the important factors of keeping depression going. And this is why we thought that we would place some emphasis on the different types of negative thinking, irrational thoughts that we experience, so that you are all able better to identify them. When we are experiencing negative and self critical thoughts, this tends to also have a negative impact on the way we feel and the way we behave. Um, so, in the above example, we can see how Samantha's thoughts about being a failure, not being good at anything, led to change in her behavior. She started staying in bed most of the time and had difficulty concentrating and began then to withdraw from her friends. This further fueled her cycle of depression as it led to her feelings of sad, upset, and hopelessness about the situation. And obviously, if she continues with these type of behaviors, the intensity of these emotions will increase as well. Her body also reacted to all these changes and she experienced tiredness and lack of energy. She started having sleep problems and developed a poor appetite. Looking at this example more closely, we can see how Samantha's thoughts, behaviors, and feelings and bodily sensations all interacted and combined to keep her depression going. So, because all of these areas are connected and they impact and influence each other, the vicious cycle of depression can be very difficult to manage. However, since it is all connected and every aspect influences another aspect, changing one area can lead to changes in other areas and can eventually lead to a disruption of this vicious cycle. If we change how we think, this will automatically change how we behave and how we feel. So then we're going to go on to recognizing the negative thoughts that I spoke about earlier. So when someone is depressed, they tend to think a certain way. Usually it's very negative and critical. Often depressed the individuals see themselves as having a low sense of self-worth and confidence, and they also normally have a critical way of thinking about themselves and about the future. If you have been experiencing depression for a long period of time, it can often feel as though you are looking at the world through a gloomy lens. It is important to remember that these thoughts can occur occasionally, even when you are not depressed. Remember, context is important to take into consideration. The difference is that you can generally dismiss these thoughts. However, when you are experiencing depression, these thoughts are very automatic, very intrusive, and they are almost around all the time. So let's go into recognizing the different type of negative thoughts. So first we have the black and white thinking, which is also referred to all or nothing. If I'm not perfect, I have failed. Either I do it right or not at all are two examples. And I'm sure that if you look at your ways of thinking, you can come up with your own examples. So the mental filter, this means only paying attention to certain types of evidence. So for me, the problem here is that we are not making informed decisions. If we focus too much on something that is positive, it can actually create toxic positivity, because by me not acknowledging how aspects can harm me, how aspects are unfavorable, I'm not able to make informed decisions. In the same way, if I only focus on the negative or things that are unfavorable, I can't take into account what is positive, and how that is impacting me. So again, I can't make an informed decision. So noticing our failures but not seeing our successes is a good way, is a good example. Jumping to conclusions. So there are two main types here. So it's mind reading and fortune telling. So mind reading is imagining that we know what someone else is thinking, and fortune telling is predicting the future. And this is based on our own belief systems. Okay, overgeneralizing, so seeing a pattern based upon a single event, or being overly broad in conclusions that we draw. So for example, everything is always rubbish, nothing good ever happens, are two examples. Disqualifying the positives, so discounting the good things that have happened or that you have done for some reason or another, as it not counting. So that's the same more or less as the mental health filter, the mental filter that we spoke about earlier. Magnification, so either catastrophizing or minimization, blowing things out of proportion, so catastrophizing, sorry about that, or inappropriately shrinking something to make it seem less important, so minimizing. All right, and then we're going to go on to the other ones. Emotional reasoning, basically assuming that because we feel a certain way that what we are thinking must be true. I feel embarrassed, so I must be an idiot. Labeling, assigning labels to ourselves or other people and believing that this is the only thing that we are. I'm a loser, so I'm not able to do anything else, or I'm completely useless. And they're such an idiot, are examples. And then the extremes like should haves or must haves. So using critical words like should, must, out, forever, always, can make us feel guilty or like we have already failed. And if we apply shoulds to other people, the result is often frustration because many things are outside of our control. And then personalization, everything that happens in my life that is bad is a result of me. So blaming myself or taking on the responsibility for something that wasn't completely my fault. And then at the same time, we can also blame others for something bad happening in our life. Okay. And then here's a nice way to challenge your thoughts. So remember that these harmful thoughts are automatic. They just happen and are often not based on reason or logic. They are often unrealistic and unreasonable. They often serve no purpose, and all they do is make us feel really bad and get in the way of us living our life. Although these thoughts are unreasonable, they often seem and feel reasonable. Especially when we are experiencing them. The more you believe and accept negative thoughts as truth, the worse they will most likely feel. So a nice question that I like asking, is this a fact or is this a feeling? And how can I prove if this is a fact? And how can I prove if this is a feeling? Okay. Also, when we get sucked into negative thinking, we tend to view everything in a negative light. When people become depressed, their thinking does change, and it often falls into negative thinking patterns, such as the ones that we have now discussed. People use these thinking patterns as an automatic habit and are often not aware of having them. However, when you are constantly and consistently using the same unhelpful thinking style, it creates a great deal of emotional distress. Being aware of these patterns can help you recognize them. when they are happening in the moment. So psychoeducation is so important because it allows us to develop self-awareness that will allow us to then develop implementation of something new happening. So here you can see challenging a negative thought. Okay. Okay. Recognizing unhelpful behaviors. So I'm going to go over the headings that you see here. Reduced self-care. When we are feeling depressed, the first thing that often falls by the wayside is our motivation to look after ourselves. Simple tasks such as washing ourselves and looking after our appearance can become very difficult. We may stop being physically active, spend more time in our beds, and stop eating properly. When we don't look after ourselves, it negatively affects our self-esteem and self-confidence, and thus our thoughts tend to become more self-critical than usual. And this again creates that vicious cycle that we spoke about earlier. And as we tend to feel bad about ourselves and feel physically unwell, which in turn decreases our motivation to take care of ourselves. And then we have withdrawing from family members and friends. Another big behavioral change that occurs when we have feelings of being depressed is that, we start refusing invitations, we stop answering and returning phone calls, and we spend less time with close family members and friends. Social isolation is an important factor in keeping depression going, as it takes away the connection with others and the belief that we are not alone in this. We're going to talk more about the oxytocin hormone, and so please keep that in the back of your mind. Thoughts play an important role in this behavior, as due to our depression, we might think that we are a burden to others or that they don't want to be spending time with us. It again creates a vicious cycle, as our behavior can in turn push people away and put a strain on our relationships. We experience less involvement in rewarding activities. So when we are feeling depressed, two of the main symptoms are lack of energy and lack of motivation. They keep depression going as they lead to a decrease in engagement in activities that we once enjoyed, such as hobbies, sports, reading, and any type of activity that we take interest in. It keeps the cycle of depression going, as the less we participate in these activities, the less we feel able to do so, and the worse we feel. We may no longer experience the enjoyment or pleasure that we used to receive by engaging in these activities, and this in turn can lead to more negative emotions and thoughts, such as feeling low and thinking that we are useless. Problems with everyday tasks. Due to low mood and a lack of energy or motivation, we find it more difficult to do everyday tasks. Things such as doing the dishes, taking the rubbish out, cleaning our home, fulfilling our chores, running errands take more energy and effort for us to complete. We might even put them off and not do them until the number of unfinished tasks becomes really overwhelming. This again creates a vicious cycle that keeps our depression going, as it can lead to a more negative emotions and self-critical thoughts, such as I am useless and I can't do anything right. So treatment for depression. The good news is that we can do something about these thoughts, feelings, and behaviors to change this vicious cycle of depression that we've been discussing. Some people may be able to deal with depression on their own, while others need professional treatment. However, for many people, getting some help and tackling this condition can be very helpful and useful. The first step to getting treatment is seeing your local general practitioner or mental health care practitioner, and then they will ask you a series of different questions to assess whether they think that you have depression. They will talk with you about possible treatment options, or they may refer to you for a mental health care practitioner. So, for example, if you're seeing a counselor, they may refer to you a psychiatrist. If you're seeing a GP, they may refer to you to a psychologist. The two main approaches to tackling depression are talking therapy and medication. These may be used individually or a combination. Remember that because people experience depression so differently, it is important that your treatment is tailor made to your experience. They keep depression going as they lead to a decrease in engagement in activities such as hobbies. So, what's very, very important is that we understand that although we may have similarities and differences with people that share depression, the way in which we are treated is different because of the intensity, the frequency, and the combination of such symptoms. Okay. So the aim of, sorry, I just want to go, yeah. The aim of talking therapy is to relieve psychological distress through expressing our thoughts, our feelings, and discussing this with a trained therapist. It will help us create better understanding with our difficulties and guide us as we begin to identify and plan different ways and strategies for overcoming depression. There are different types of talking therapy, however, all of them involved a trained practitioner. They may be delivered one to one, or in a group, or with your family, or with your partner, and they may also take place face to face, online, or telephonically. For some difficulties and conditions, one therapy may be more suitable than another, and overall, different styles of therapy suit different people. So research has found that the following therapies can be very effective in treating depression. So you have cognitive behavioral therapy, counseling, psychodynamic therapy, mindfulness-based therapy, interpersonal-based therapy, problem-solving therapy, behavior activation therapy. So it's important to understand that whichever model of therapy is used, it normally takes some time before you begin to notice any changes. However, don't let this discourage you, as research has shown that these therapies tend to be effective and have helped many people. So medication, another approach to treating depression is the use of medication. When you talk to your general practitioner or your psychiatrist about depression, they may prescribe an antidepressant. So antidepressants may be used on their own or in combination with talking therapy. And there are many different types of antidepressants for many people. So remember that there's also a trial and error process involved when we are taking medication. So please just be patient with the process. Speak to your practitioner about the side effects that you may be experiencing. All right. So let's talk about the hormones that influence our mood. So remember that depression is a mood disorder, and here we have our daily dose of hormones that influence our mood, and they are dopamine, oxytocin, serotonin, and endorphins. So dopamine is basically linked to a sense of achievement, a sense of accomplishment, a sense of ticking something off. It enables motivation. And then oxytocin is feeling that connectedness and belongingness with other people. Serotonin is the release of stress hormones and stabilizing our stress as well. And then endorphins is releases, a brief euphoria to mask the physical pain, and it is a response to pain and stress that alleviates anxiety and depression. So if we look here, so if I have a deficiency of the following, so for example, if I don't have enough dopamine, I might experience procrastination, low self-esteem, lack of motivation, low energy or fatigue, inability to focus, feelings of anxiousness, feelings of hopelessness, mood swings. If I have a low level of oxytocin, I might experience feelings of loneliness, stress, lack of motivation again, low energy or fatigue, disconnected in relationships, and also sleep changes, If I have a low sense of serotonin, I may experience low sense of self-esteem. I'm overly sensitive. I'm more exposed to anxiety and panic attacks. I have mood swings, feelings of hopelessness and helplessness, social phobia, obsessions and compulsions, and as well changes in my sleeping behavior. If I experience a deficiency in endorphins, I experience anxiety, depression, mood swings, aches and pains, changes in my eating and sleeping behaviors, as well as impulsive behavior. And then we have how to increase these hormones. So if we look at dopamine, how to get our dopamines activated, we can do a daily to-do list, set long-term goals that have been broken down. We can create a daily planner for ourselves to follow. We can create something in terms of writing, music, anything that offers us a sense of accomplishment. When we are looking at how we can increase our levels of oxytocin, we can look at creating physical touch, socializing, and also connectedness to ourselves and to other people. And then if we want to increase our serotonin levels, we can exercise, expose ourselves to sunlight and endorphins. If we want to increase our endorphins, we can experience laughter or crying, creating something, eating something that's nice, meditating, can all be very, very helpful. And then I'm going to end this session before we go into questions with some key points. Okay. Everyone feels sad sometimes. That does not necessarily mean that you have depression. Once these feelings are accompanied by thoughts and behaviors that are overwhelming and persistent, then it may be more serious. Depression is a serious and common mental health disorder and condition and is not something that we can snap out of. There are many different types of depression, and thus the different types of depression also influence the treatment. There are many different types of treatment for depression, and the most common used is talking therapy as well as medication and a combination of these two. And the vicious cycle of depression is maintained by a combination of thoughts, feelings, behaviors, and bodily sensations. And remembering that changing one area can lead to change or influence in other areas and eventually lead to a disruption of the vicious cycle. So important to remember that depression is created over a period of time, and it will also take a period of time for you to achieve a better sense of wellness and health. Thank you so much for having me. Please know that questions are welcomed and encouraged. There's time now for questions. So anything that you want to ask regarding depression, anything that you want to check in with yourselves, please use this space. It is here for you. There's no such thing as a stupid question. Please take notes of that. I'm sure that if you are thinking it, someone else in the crowd will appreciate you asking because they are probably thinking that as well. I am going to direct you to individual counseling if I see that this is not the space for you to be asking these questions, because confidentiality is important and there are many people in the session. So I am going to be mindful of that as well. So yeah, we can answer some questions now.
Thank you, Nadia. That was so informative session and so much information. I think many of our participants today just learned something new. I want to ask you some of the questions that's come up in the chat box. So there was a question that asked, can depression go away with treatment or medication assisted with coping?
So I think that move away from the narrative of it going away and maybe focus on how can I manage this? How can I influence this right now? And that will in itself create a better level of wellness for you. Remember that our understanding of wellness changes over time. It changes with the phases of life that we are presented with. It changes with the different influences that we are presented with. So please don't be focused on what it will look like and what is it, how do I get there. Understand that we can use that as a basis to what can I work towards, but find it where it is and work with that. And that is, I hope that answered your question.
Yeah, so it's mostly, you may live with a condition. That doesn't mean it is your identity. It
Absolutely.
doesn't mean it should rule your life. Um, I know I once saw a video, and it's I don't know if you've seen it, Nadia. It's about depression is like a big black dog. Have you seen that video?
I haven't, but please share. What does that? Please share
So
the content.
the content is basically that it's this dog, and it becomes so big that it sits on you, and it just all over you, and it just rules your entire life. But nobody wants to talk about this big black dog. And the moment that you actually just acknowledge it and start working with it, then it becomes smaller and it becomes more manageable, which is the point. So if you
Thank
guys want
you.
to
I
look at
love
that, I think it's on
sharing that.
YouTube.
Thank you so much, because I think that you're touching on something so important. Just because we pack it away in the back of our minds does not mean that it's not there. And another thing that I want to touch on that you said earlier is that please know that you are not a depressed person. You are someone with depression, and you are someone capable of so much more than this condition as well. You have resilience, you have other characteristics that can assist you. And it's almost like when we label ourselves as a depressed person, that's the range that we allow our brain to function in. There's a difference between saying I am a depressed person, and there's another person saying that I am someone with depression. The range of how we see ourselves challenging this condition, navigating, managing this condition changes with how we interpret it, how we perceive it for ourselves as well.
So another question was, can depression be treated or cured by exercise or excessive exercising, everyday gym or endurance activities, road running, Ironman, etc.? And if so, what are we to estimate that people that engage in these activities to be depressed?
Okay, so the first thing is we are so multidimensional by nature. I don't advise doing one thing, because you are not only a physical person, you are a psychological one, an emotional one, a spiritual one, an intellectual one, a social person, and there's so many different perspectives of self. And remember that depression it influences all areas of our life, and it's not enough to just focus on one area. Although it will influence an area or other areas in your life, it won't change it as significantly as if you were to focus on more areas of your life at a time. Um, it also doesn't mean that because people partake in more running activities or more exercise activities that they are depressed. Remember that depression looks different for different people, and I think that's important to take note of as well.
But a healthy lifestyle like exercising does endorphins in your brain, so it can help.
Yes,
Being active,
yes,
meditating, being mindful,
yes.
help with the thoughts, helps with the feelings. But it doesn't mean that you won't have depression if you are a Ironman participant. It just means that it does help your brain. Am I correct, Nadia?
Yes, yes. So again, so the specific mood influencing hormone that we are talking about then is our endorphins. So it will influence the levels that we experience of endorphins. But remember that that is not the only mood hormone that you have. So I strongly encourage that you participate in other areas of your life as well, to welcome more experiences that can help you manage the condition.
Right. I want to see if there's a question. Can burnout eventually lead to depression? I think that is a follow-up of last month's talk about burnout. Can it lead to
Yes.
depression?
So burnout, if it's not treated, it does eventually lead to depression. But again, remember that burnout is very much centered around our work life, our professional being, whereas depression influences all areas of our life. So because the consequence of burnout changes how I'm responding to other areas of my life, that's why it then eventually becomes depression.
Okay. What is the difference then between stress and depression?
So stress is something that we experience. So stress can actually be very healthy. It's a certain motivator. So remember, anything by itself is not considered a concern. Remember that depression is a combination of different symptoms that are really severe. So mild, moderate, severe. The combination of these symptoms that affect the way we think, the way we feel, and the way we act. And this really does have an impact on our functioning. So, how we are integrating into the environments, how we are responding in our relationships, how we are carrying out responsibility. So, stress doesn't, it's almost like something like if you remember that differentiation that I made between sadness and depression. So, sadness is something that passes, stress is the same. Depression is very persistent. It's a combination of different things and it's here for a long period of time.
Yes, if I remember correctly, the diagnosis for major depressive is 2 weeks of
Yes,
constant
yes,
feeling depressed and
yes.
other symptoms.
And remember that you can experience stress for 2 weeks, but I think context is very important. So, for example, if you have a work deadline or if you're writing exams, you will be stressed, but within your context that is appropriate. So, remember that before a disorder is diagnosed, context is always taken into consideration. Yeah.
Right. Yeah, I think that was also going to stress is also going to link well with our next topic, which will be on anxiety, because
Yes.
stress and anxiety, sometimes we get confused between the two. But yes, thank you. Thank you, Nadia. I want to ask, I have tried all medication that the medical aid pays for, and they all make my condition worse. And now I'm forced to take extensive medication that the medical aid won't pay for, even though it's prescribed by the psychiatrist.
Oh, I'm so sorry. I know that this is such a challenge that we experience with psychiatric medication is that there's no blood test, there's no x-ray that can show, okay, you need this dosage and you need this type. It's such a process of trial and error, and I'm really sorry. I understand that that can be so demotivating and upsetting. Please keep your practitioner updated. So, either your psychiatrist or general practitioner that updated you with the medication or prescribed the medication. Please keep sharing your experience with them. I understand that it's frustrating. Please don't stop cold turkey. It really can be quite dangerous in terms of all of a sudden the brain has been exposed to a certain level of hormones and then nothing at all. So please know that there is a certain process that needs to be followed. You have every right not to want to take medication, but it needs to be in your best interest in terms of how you wean off this medication as well.
I have a comment here that I have my daughter, she's 14, seeing a counselor that's above 60 years. And I feel that the counselor assigned is way too old for my daughter and doesn't really relate to her. Can I ask for someone younger? And I feel it's quite important for you or someone that sees a therapist to be able to relate, to able to have a bond in that way, because it's a therapeutic relationship, isn't it?
Yeah, I think what's important to understand is that if your daughter is comfortable with the therapist, I think that's first and foremost the most important is to assess, is she gaining anything out of this experience? How does she feel about this therapist? Remember that a therapist meets a client with a skill set, and I understand that maybe age and race and gender and economic status or religious can influence that, but we are trained to not let that our things get in the way of the process. That's not ethical. It's not allowed. So if you are worried about the therapist's opinions of life being projected onto your daughter, know that we are trained with that is not allowed, where we are trained to be mindful of these processes as well. And also, I just want to emphasize that it's okay for you to not get along with your therapist on the first session or the second session. It is a personal connection to begin with, even though the person offering the skill set is there. I really recommend that please find someone that you stay comfortable with. You're going to be sharing a lot of vulnerable information, and you need to be comfortable with the person that you are sharing that information with.
I agree. But I do know that certain therapists are just gifted to work with specialized cases. For example, I know a therapist that is her personality just matches teenagers, and she just works so amazingly with them. And another colleague of mine that works amazing with men. And I would never have I've thought this, but they relate to her, and that she just has this point of being, and that's what they need. So maybe speak to the counselor and ask. Maybe
Yes,
speak to your daughter
yeah,
and ask, what
yes,
is her
yes. Ask her
experience?
what her experience is like. Absolutely.
Let's see if there's another question. Does mental health medication affect fertility, especially when on birth control?
So the side effects are something that I really encourage you to take up with your doctor. So if you have concerns around fertility, for example, or anything else, please take it up with the doctor that is prescribing medication to you. Unfortunately, there's no general rule for these type of medications. I really advise that you rather speak about those concerns with the person prescribing the medication to you.
Definitely. I have a lot of questions based on depression because it's something that has affected me and my family badly. So we have access to talk. So do we have access to talk to you outside of this meeting? Sorry, I can't share those questions here, but it's sensitive. So can they email Tempo and we refer them to you, Nadia?
Sure,
Okay.
sure.
So any members that want to contact Site or Nadia, please email tempo@bestmed.co.za and we will forward it to them. Okay, I was admitted for 2 weeks in July and currently still on outpatient treatment and medication, but still exposed to many triggers and suffering from many physical negative symptoms, such as body ache, especially headaches and dizziness. What do you advise?
Oh, I'm so sorry. We go in for treatment and we come out, and I think managing our expectations can be quite helpful. And I know that a strong sense of hope is attached to, okay, now I've, been exposed to this information and I'm going to create all these changes and these things are going to start changing. Remember that it took you a while to get here, and it's going to take you a while to get to a different point of wellness as well. And I'm just going to encourage that please be persistent, be intentional, be meaningful about your process. And also, I need you to know that if you have a bad day or a bad moment, that's okay. It's part of the process. And if you feel that you need more levels of support, the frequency of support, please make arrangements with your mental health team that assisted with those 2 weeks. And I think that unfortunately we can't run away from triggers, so triggers will always be there. It's how we relate to these triggers that change and ultimately influence us. And again, that also takes some time to change.
Thank you. We have a question here. I feel so stupid to ask the following. I've been
No.
I've been crying most every single day for the past 4 to 5 weeks. I blame the fact that I miss my grandchild, but I really don't think it's normal. I don't sleep good at all. Don't want to socialize, lots of headaches. I do use antidepressants, Lexamil. Should I go see my GP?
So I would recommend your general practitioner. I would also recommend finding someone that you can have talk therapy with, um, because it sounds like there are symptoms that definitely need to be attended to.
What criteria should people look for or compile to overcome depression or deal with it? Depression from sexual abuse or assault.
All right. So sexual assault, the criteria for what stipulates what sexual assault is the same for everybody. The experience of sexual assault is different. And I strongly advise that you take that up in individual counseling and see how is it that you relate to this situation? How did this situation change your life? What is it that you've done differently because of this situation? How have you developed different thinking patterns because of the situation? So that will be different. There's no linear or standard answer for that. I really encourage that you explore that subjective experience in individual counseling, please.
Sorry, I just want to see. There's quite a lot of questions. Can depression lead to epileptic attacks or episodes? I've recently started with therapy and I have been diagnosed with epilepsy a couple of years ago, but I'm not sure if I'm getting the right help.
So it's within your right to get a second opinion, but also be intentional around why you are getting a second opinion. What is it that you would like from that experience? Depression, so basically the mind listens to the body and the body listens to the mind, but depression doesn't have a single cause, and I'm just going to re-emphasize that it may influence it, but it doesn't have a single cause. Again, please follow up with the team that is treating you, and they will be able to assist you further based on your subjective experience and the influences that are affecting you specifically.
There's another question that's very interesting. What about family therapy for depression or mental health issues?
I think that family therapy can be very helpful. However, it's important that family members are open. Otherwise, they won't experience that assistance in a sense. It's basically, I only hear what I want to hear, if that makes sense. Um,
Okay, okay, now. Yeah, I'll do that now. Okay.
Sorry.
Just trying to mute the participant.
Thank you. So family therapy can be very helpful, but I really encourage that please talk about it as a family first. See if everybody's on the same page, and then your therapist will guide you through the process of how to communicate in the session, and how to mediate between that family session as well.
Then linking to that, how does social media affect depression or depressive episodes? Should it be avoided?
Again, there's no one single cause. However, social media can influence us, especially when we see everybody on a nice holiday and we are working. It can make us feel very sad, very annoyed, and it can make us more aware of what we don't have and what we're longing for. But remember that there's no single cause of depression, and too much of anything is bad. So remember, keep yourself in check. What does social media, how does it impact you? How does it influence you? What is helpful? What is harmful? And your answers will look different to your friends, and that's okay.
There's a question here, and it touches on one of the topics that you are very passionate about, Nadia. It says some men do not believe in therapy. How can a male be assisted if he refuses to acknowledge that there is a need to seek professional help, but his behavior is very disruptive and causing a ripple effect of sadness on the people around him.
Sure. I'm so sorry, and I know that this is something that a lot of people experience where we can see that there's a need for help, there's a need for support, but the person that needs it is not open to it. What you can maybe seek is help for yourself in terms of how to safeguard yourself, because unfortunately, as much as we want the best for people, that's not always in our control, especially when we are working with adults. They have the right to make their own decisions. However, you also have a right to make decisions in what you are willing to be exposed to, your level of involvement, and what you are willing to share within that space. And these are things that will influence you once you start making decisions based on that as well.
How do you explain that you have depression in the workplace that is not receptive to mental health awareness?
I think it comes down to what is the intention. Why would you like your workplace to know that you have depression, and what does that mean for you? Remember that you can live a very healthy life and carry out your work-life responsibilities while having a mental health disorder. So I think start with what is the intention of you disclosing your condition to your workplace, and what type of consequences will you sit with, and is that something you are open to manage? Is that something you can manage? And I think then if you are happy with that, start with human resource. They will be able to assist further.
Thank you, Nadia. I think we've covered so many questions on such a broad spectrum of, what depression is and how does it affect us, to medication and treatment. And I want to ask our members, please, if you have questions about Bestmed and how we can help, please email Bestmed so that we can, on a specific case, look how we can best support you. If you want to, you can email Tempo and we will direct it to the correct department and see how we can best support all our members. That is why we are here. That is why we are hosting these discussive groups, is to engage, to talk about these very important topics and to provide you with support services. Nadia, I want to really thank you for today. It is so informative and such a crucial topic. Thank you for making yourself available to us.
Thank you for having me. I really do appreciate it. And again, if the attendees have any questions, they can forward it to Psyched, where we can have them answered. And please, there's no such thing as a stupid question. Please inform yourself so that you are better able to make decisions that are impacting you, that are influencing you. Be mindful about creating awareness, understanding who you are, what you are, because this really can assist, especially with this condition of depression.
Thank you. Thank you, everyone, for attending. Have a great afternoon.
Thank you so much. Take care, everyone. Bye-bye.
Thank you. Bye.